Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, Doctor of Acupuncture and Oriental Medicine, Chinese medicine herbalist, and founder-director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Bianca Rodriguez, a holistic psychotherapist, Leona West, a clinical nutritionist and herbalist, also trained and certified in functional medicine, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is COVID-19 vaccine experience. Well, I just wanted to share my experience. I went to get the vaccine yesterday, and I'm in LA. The location was Crenshaw, which is the closest at this point to the West Side, which is where my office is, in the Santa Monica area. And how did it work? Well, I got, through the city of Santa Monica first a link to find out how things work in terms of phases and stuff like that. Let me kind of bring this up just for a second so I can clearly refer to it.
This is the LA
Oh,
County
yeah.
Department of Public Health site.
Yeah, publichealth.lacounty.gov. So I'm considered phase 1. I mean, it's debatable whether I'm tier 2 or tier 3. Tier 2 would be primary care clinics, which in the state of California, acupuncturists are considered primary care practitioners. So health workers in the private care clinic would be tier 2. And then later it says tier 3 healthcare workers such as in acupuncturists. So anyway, either way, they're both green lights, so they're go-aheads. Soon, hopefully, we'll be into phase 1B, which is a big group, which is persons 75 and older and stuff like that. But at any rate, so I went to, through the site to get my appointment and gave all the information. And they do ask for insurance information. Even though the shot is covered by the government, the administering of the shot will get covered by your insurance company. So I had to give my insurance information. And then they ask you a bunch of questions online, like, have you had the vaccine? Have you had COVID? Are you allergic to any of these medications or side effects, any of these things? And some questions like that. And then after you fill all that out, then I got really nowhere because there's no appointments available. So they said, we'll contact you. But then another colleague sent me a different link through the government site. And I was able to access an appointment, the same kind of format. I filled out all the information a second time and got an appointment for the next day. And the next day was yesterday. So I went in first thing in the morning, which is what I'd recommend, because my appointment was at 9:50. And by the time I got there, there were, a lot of people. But by the time I left, there was definitely 5 times the amount of people. There was a lot more people, and there's lines of cars just to get even to the area, just to park. It was a little confusing, where to park, because my GPS took me to one location, and there's a sign saying, no, it's not here, go to this place. But I'm driving, so it's hard to understand, like, where am I going? But finally, I found it, and then got in line, and they did a really, really good job of physical distancing people, because there was a bunch of people. Now, these are not mega sites. This isn't Disneyland yet, which has opened up, I think, earlier this week, or Dodger Stadium. This is a smaller, place, which I think does, I think hundreds to maybe a few thousand a day, as opposed to some of those big mega locations are going to probably be doing tens of thousands a day. So probably 15 minutes, 20 minutes online. Then they check your professional license to make sure, because even on NPR, they were talking about this. There's a lot of concern about people cutting the line or concierge service getting access, which is not happening. Concierge medicine isn't able to get these vaccines any earlier, so money won't buy it right now. And then you get into another line once you get in. And then they ask you a bunch of questions again. And then you check your government issue license, which for me was a driver's license. And then you get into another line. And then that line, all these lines are moving pretty fast within a few minutes. And then you sit down. I had a registered nurse, an RN, administer the shot. I chose my left deltoid because I'm a righty. less dominant. It was on the left side. Didn't even feel it at all. I asked, do you mind if I take a photo, like, while you're doing it for absolutely. They they don't want you taking photos of like the whole site though, because that means, the patient privacy. You're really not supposed to take photos of other people, but you can do yourself. And then after the shot, which took 2 seconds, then I went into a holding area for 15 minutes, which is also outdoors. Everything was outdoors. Everyone's separated. Because I guess if you're going to have a negative reaction, it typically happens within the first 15 minutes. And you sit there, fine, checking your phone. And then then you're welcome to leave. And then when you leave, they give you a card that has, I got Moderna, and has the lot number, has the day you came in, has your name, your contact, your date of birth, all that stuff on that. And also the information about when you're supposed to return. And for Pfizer, it's 3 weeks, but I got the Moderna, so my follow-up is in 4 weeks. So that would be February 11th.
That's my birthday.
Go Aquarius. Yes. Yes.
That's right.
So it was a good experience. I mean, I think they're totally professional. They told people what to do, which I appreciate, because masses tend not to, know what to do. They direct everybody, kept everybody as safe, I think, as possible. I was in and out in an hour. And I feel fine. I mean, a little soreness in the deltoid, in my shoulder, a little soreness. Might have had a little hypochondriac feeling, like, am I feeling dizzy? But that might just my own anxiety after getting the shot. And I feel fine today. It was windy last night, so I didn't sleep entirely great. So I might just be a little sleepy just from, I didn't sleep entirely well, but that when it's windy out, I don't always sleep very well anyways, but I feel fine today. So I'll go back in 4 weeks. That was my experience.
Hey, Brendan, yes. I want to know, though, were you worried? Like, were you anxious? What made you decide to get it versus waiting? I mean, what was the thought process?
Yeah, I mean, I looked at the science, and I trust in science. That's what I do professionally. That's what my family does. My father, who's a urologist in Connecticut, had his first shot weeks ago. I think his was also Moderna. I think he's getting a second today or tomorrow. So, the science looked good. I believe you got to be part of the solution. I mean, if anyone else has any other ideas of how we're going to get through this pandemic, and how we're going to get through COVID, I'm all ears. But otherwise, we need people to be not carriers and not spreaders, and not dying and getting really sick from this stuff, which means vaccination. Even though I totally understand, and I am definitely, in my family and myself, I'll confess, I believe in limiting vaccines as much as possible and spreading them out as much as possible. And that's what we do with our children. But I do respect other people's, choice of, following very, very strict and doing, and perhaps more vaccines for, that their pediatrician might recommend. And I also can understand some people who have a lot of fear and anxiety and nervousness and not wanting to do vaccines at all. So it's a good conversation to have and good thing to think about. But I'm glad I got it done. I felt confident with the science. I felt confident with the companies, Moderna and Pfizer. And again, it's been a year, so it's like, got to do something.
And to, excuse me, to be clear, and I think it's honorable for the scientists and the companies to say this, they are not saying that it reduces the transmission, because that's something that I think just methodologically with the way that they designed the studies, there was no way that they could prove that. So they're not even speculating about the transmission. Personally, I think it must decrease the transmission to a significant degree. That would just be my speculation, but the science and the scientists are not saying that getting vaccinated is going to reduce transmission, at least at this point, because we don't know. But you'd have to think it would, just speculating. So, but yeah, then these are great points. I think, just hearing your experience is important. This is LA County, which is huge. It's a gargantuan task to just organize this and put this all together from the website to the individual clinics, and it sounds like you had a good experience. I actually tried to sign up a few times and kind of didn't really get anywhere yet. So I think a lot of my patients are asking, like, how do I sign up? Like, what's my phase? I think there is a lot of information if you go on that site. And I would assume that over the next even week or two, it's going to become a lot more clear and a lot easier to be able to figure it out and figure out when you'll be able to be vaccinated. So just logistically, I'm getting a lot of questions like that. And then of course, I'm getting a lot of questions about, should I get the vaccine? And that's an ongoing question.
Yeah, and I understand, you know, I understand some people are nervous and not sure if they want to get it. I'll just show you my, this is, that's
Mhm.
me. So,
Yes.
That's
you
great.
know, that's the way it goes. I don't know. What do you, Leona, what do you think? Or what do you guys think? Or the rest of you guys, how are you guys feeling about it?
Um, you know, I definitely am an evidence-based, you know, science-led practitioner as well. And with that, since it is an emergency experimental drug at this point, in a very plain way, if we are volunteering, as you did, you're volunteering to be part of the trial, which is honorable. And I think because of that, because we're still in trial phase, it has to be individual. We have to take under account a person's physiology and genetics and risk factors, and each person has to have the right and the access to get the vaccine or to wait. So I think it's just, we're at a stage now so early that we just have to continue to tailor it to each individual circumstance.
And I do have some patients who, you know, are not wanting to take it, and some that are question mark, and some that are very much wanting to take it. So I have, you know, and all the
Same.
above.
Mhm.
Um,
Mhm.
but, you know, anyways, were you guys gonna say something?
I agree, and my general feeling so far is, at least the inquiries that are coming into my office are, and it may just be that that's the inquiries that are coming in, but I'm feeling like there's a lot of people that are just, they want to have it done yesterday. Like, and so in some ways, as you're saying, Leona, I feel like it's going to work itself out naturally, in that the people who really want the vaccine are going to be getting it. And then those who are for individual health concerns or other reasons that are not quite ready to do it, will get it a little bit later, and it's going to kind of work itself out like that, and everyone's going to kind of feel happy about it, and that we will get to that point where enough people will be vaccinated, as you're saying, Brendan, that it's going to start to make an impact. And I do believe that, and hopefully soon. So and we will, like, you know, there are 11 million people at this, as of the time of this recording, that have gotten the vaccine. That's a lot more than the 70,000 that were in the trial. But it is 2 months in the trial, and, you know, now 3 months to the extent that they're still following people. That placebos are starting to wean, to not be as many, because those that had the placebo in the trial are now getting vaccinated. But it is ongoing. And data still looks good, but there are reports out there of problems. Now, 1 or 2 or 3 or 4 out of 10, 11 million is a lot different than the close to 500,000, 500,000 people that have died or had other consequences from COVID, but it's not nothing. So that is something to consider.
Or even just looking at the two different vaccines, where Pfizer, there's been a lot more reports with side effects from Pfizer as opposed to Moderna, with regards to the difference in the additives in the vaccine. So again, like to your point, there's these different things that need to be looked at and worked out, you know, as we're going along, because we are so early in with an entirely new biotechnology. This is not the OG vaccine, you know, it's kind of a totally new technology. So there is a lot to learn.
And I know we have to go in a minute, but Bianca, you might be able to speak to the concept better than I would, about just the psychology of actively making a decision versus sitting back and waiting to possibly get COVID, and the psychology of that in
Yes,
terms
yes.
of deciding.
Yeah, I mean, I think that there's a factor that plays into it, so when we weigh the risks and the benefits, and it's like, well, if I could get COVID and I don't know what that experience is like, and it could cause long-term health, you know, problems, it could be a horrible experience, and ultimately it could lead to death, right? But if you feel like you're doing everything you can to protect yourself, right, it's like you're taking an action to remove yourself from a situation. Whereas with the vaccine, it's the opposite, in that you are actively seeking out something that could be incredibly beneficial, but it also has its own risks, because we do have those stories of folks, that are having negative, really negative, potentially, dying of the vaccine. Yes, it's a very, very small percentage, but I think there's something psychologically about protecting yourself and avoiding something versus actively taking an action. It's kind of like, right, it's kind of like jumping out of a plane. It's like that could be really invigorating, and usually it's safe, right? Most of the time, and it could be life-changing, right? But it's like, you're the one that's got to jump. You know what I'm saying? So there's a different type of motivation required to do that versus, I think, sort of sitting back and just sort of avoiding something, right? So I think that that's the psychology that plays into it as well. And there could be some cognitive dissonance there, because we are designed to protect ourselves. And when you're doing something that could be risky, you're like, it's risky, but it's going to protect me. But like, how does that work? So yeah, we're all navigating this. And I like, everything that you guys have said about like just really reminding ourselves that we are really in a very early phase. This is still exploratory. It's still experimental. We don't have all the information, and everybody's going to make a decision based on their comfort level with the information that they have. And I think it's important. Brendan demonstrated this beautifully. He chose to get the vaccine, and he also respects people all along the spectrum of their decision making.
Thanks, guys. Well, that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thank you for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in the well are limitless.